try.
Yeah, I'm just going to ask you a few questions. Only a couple people in my group have to see it, and then we make a paper. So this is my dad.
Oh, I thought you were going to ask him a lot of questions.
I don't think it's a lot. So my dad's name is James Madison. And when were you born? Because you had kids late.
November 26, 1940.
Okay. Okay. So tell me about how you came to be diagnosed with Parkinson's.
I work as a respiratory therapist at the hospital, or did. And one of the physicians noted that when I was walking down the hallway, I wasn't swinging my arms properly. And the physician... Sure. Oh, yeah. Do I need to start over?
No, just keep going. It doesn't matter.
All right. He noticed I was shuffling my feet, and towards retirement at 70 years of age, went and saw the doctor, and he diagnosed me as that about 7 years ago. And it at first wasn't so bad, other than the shock that I had this chronic disease that has no cure. And here I've been on my feet all my life as a respiratory therapist and other jobs that I had. And it initially, before I knew what it was, I'd be walking down the hallway, and I would kind of take a dip to the right unexpectedly and wondered why I did that, and just dismissed it as, oh well, I'm getting older. It happens.
Yeah, so you are about to be 77 in 2 days.
Yes.
So, let's see. Okay, so were there any, what were your signs and symptoms? You kind of mentioned some. Were there any others besides that dip when you're walking and your gait was funny?
A slight pain or discomfort in my legs, and wearing out, which I took as being a person of 70 years of age at the time, but my stamina was not as good. My work entailed doing breathing tests on patients, and so when they came to the hospital, I'd go get them and walk them back to our area where I did the testing, and a couple of people took note that I wasn't walking or shuffling correctly. So I got, I kind of informed my patients because I kind of ignored what was going on.
Hunter, go that way. Sorry, everyone. No, my son's coming out. Okay. You said you were 70 when you were diagnosed?
Yes.
Yeah, okay. Has your condition changed over time? If yes, how? I could answer that, but...
It gets harder. It takes more effort, and I'm not an exercise crazy person. And the reason I bring that up is that exercise is an important part of staying mobile. Because if you don't use it, you lose it, as you've heard, we've all heard. And of late now, I have to plan my. For instance, if I'm going to have lunch or have breakfast, I run over to the kitchen and I have to kind of plan ahead to do it with the least amount of effort, quite frankly, because it gets painful after a while. I have edema in both feet. My muscles seem to wear out rather fast with a burning feeling,
jeez.
Where it's impossible to pick up my feet. It just, all I get is a big ache and a hurt. But I use a walker, a really nice one, for generally on smooth floors that gives very little effort to use. And I started out with an aluminum one, here's another symptom. I drop words once in a while. And more than I probably would like to admit.
Of course, I need to plug in my phone. Okay, but so you were walking pretty good 7 years ago, and
Yes.
it's gotten pretty bad, like
Yes.
pretty quickly. So,
Yes.
sorry, gotta plug in my phone, so I'm gonna put you farther back. Okay, let's see.
About the Cadillac walker.
The walker that I referred to, the one that's works the best for me on smooth floors, has a braking system which is quite excellent. It's safe.
It's not a braking
Well, it's not a braking system, but I kind of think of it as. In order to go forward, I have to. Well, remember the brakes on our bicycles, where we grab and you squeeze.
Yeah.
Well, this, when you squeeze, lets you go forward. If I drop it or something happens, the levers automatically go up and goes to a stop. And it offers, it's a nice unit. It offers stability.
Okay. Hold on. So let's go back to. I'm going to go back to the questions. Guys, go in the other room, please. Sorry. How do you manage your condition? So I know Mom sent me a list of all the medications. So I have that. So you take all these medications, but how else? I know you work out when you can. When you can.
Workout,
is when you're able.
yeah. There's points where I freeze totally and I cannot even move, even with the walker. And that is not a pleasant feeling in my legs whatsoever.
What about let's also talk about your diet with the medication, because you can't have a lot of protein during the day, right?
When I first learned about the protein thing, it was a 4-hour wait before you could take any real protein in your body. But the latest I've heard is an hour and a half, so I could fit that in between and build my muscles again. I've lost a lot of muscle.
Yeah.
Of course, that's an old age too, but I think this is hurrying it along.
Yeah. Well, so you used to weigh 300 something, right? Like.
Years ago, yes.
Yeah, and now you're what, 220ish,
Yes.
if not lower since I've seen you. Lower now.
Maybe a
Okay.
little lower.
Okay. Yeah,
My
and
arms are skinny now. They used to be rather thick.
yeah, you were way taller than me. Now you're not.
That's right.
So yeah, okay. How else? Is there anything else? How you manage your condition? You stopped driving what, like a year ago?
Year and a half.
Year and a half ago.
Yeah,
I was in 2 years.
I did that without any real problems because I never would want to harm anyone by making a misjudgment in driving.
Yeah.
And so I stopped it.
Any way else you manage your condition? I do have the list of medications I'll send.
Well, the medication, of course.
Yeah.
That ammonium is milk and magnesium.
Yes, I have in the work drop salt.
Milk and magnesium. Oh, yeah, for acid reflux.
Acid reflux and the constipation is a big thing with me, it seems.
Does that have to do with Parkinson's or not?
It's because of the meds.
Okay.
Meds and maybe Parkinson has something to do with it, but
Okay.
milk and magnesium, it works really well if I take it once a day
With prune juice.
with prune juice. And it took a little while until I found the right combination because no matter what, it seems like I always ended up with constipation, which is a real pain, quite frankly.
Okay. Yeah. Is that a joke? Do you have any? Do you have any other health issues?
Not really. I've been very healthy all my life. I think I had 3 days that I was sick out of a over 30-year work most annoying thing about this is just as you see what I'm doing is that I form a sentence in my mind, clear as a crystal, and by the time I get to the end of it, it's sometimes disappears on me. And I've learned that this is not unusual. I've talked to other folks who have the same problem. I guess old age even brings it on.
Yeah.
I understand that people in my condition usually have some form of dementia or Alzheimer's, and so far I think I've escaped this so far.
He has mild dementia according to the doctor.
Yeah, well, you forget sentences, little things. Yeah, little things. So, okay. Do you take any medications? I got a list of it. So, how does your condition impact your ability to do activities you want to do?
It shuts me down. I can't, it makes you housebound. And the reason being is that you get an active bladder that doesn't give you a whole lot of warning, which has not been partially rectified with medication from the doctor.
Cool.
But I always have to, even going out, I have to plan every move, every contingency, and quite admittedly, I worry a lot, and what I think is going to happen usually doesn't happen, and I have to get over that. But it's hard to get out.
Yeah, so you miss church sometimes, you miss working out, you miss
Yes.
your Parkinson's workout group, and you can't drive anymore, which you love.
When was the last time we went to the movies?
Oh yes, the last time we went to Harkins here to see a movie,
Halfway through.
halfway through was it? I needed to use the restroom, and I got up and started walking towards it in an area of a small hallway. There was nothing to grab onto, and my legs decided that they wanted to ache like crazy, and it took me a while to.
You had your cane, didn't you?
Yes, I guess I did, but it probably couldn't have made any movements without that.
So also real quick, so sometimes you can't move your muscles, but you like get up, but sometimes you're in the middle of walking and you freeze, right?
Yes.
And you can't, you have to,
Yeah.
yeah. I just want to
Each
touch on
individual,
that.
a little background on that. Each individual has their own special problems. The gentleman or young lady next to me would not have that problem, but something else that I don't have. I've been basically hit in the legs below the waist.
Yeah. So your arms are still normal,
My arms
right?
are
No tremor.
no tremor.
Tremor.
Everything's
Oh,
fine.
okay. That's new.
And they offer for folks electrical.
Stimulation. Yeah. Yeah.
That's
Brainstem.
Oh, okay.
that. According to what I understand, it would not help me.
Okay.
Yeah, his doctor says it won't help his condition. It helps tremors.
Okay.
But
Wait, I thought you said he had tremors in his arms.
No, once in a while I have a little bit of shake. in
The
his
arms are pretty
hands,
good.
but
Okay.
No,
Oh, yeah.
he doesn't really have tremors. He
Okay.
never really had tremors.
Okay. This might be the last question. Let me see. What healthcare professionals have you seen for your condition?
specialists and
So you go to
three of them, the primary doctor,
yeah.
Your
neurologist,
and a urologist.
and that's right, urologist, and everyone has been a great help. I'll be seeing them at the beginning of next year. We're gonna.
Which is scary. I told them about it.
Oh, okay.
Let's talk about what about you've seen an OT before? Didn't they make you like dance or something? Wasn't that? But you it's been a while.
It's been a while. The best
Therapy.
the best therapy has been through OT in my mind. I'm not picking on physical therapists because they have their exercises to do, but in your part of the profession. It's a little more detailed, a little more checking to see the smaller things, I guess you might say. It gets very busy.
Putting on socks, things like that.
Yeah, or moving things, which I guess you've done that.
Yeah.
And I was much impressed. I'm saying it because you're involved with it.
And then physical therapy, you have worked with the gait and different things like that, right?
Tell them what type of things you did with the physical therapist and sit down.
Walking. They had a machine that puts straps around you and lifts you up, and then they have you walk on the treadmill. And if you start to stumble, you won't hurt yourself because
you're in a harness.
I'm in a harness. That's right. Throwing beach balls that try to get your coordination back to respond quickly to something.
Balance.
Yeah, balance.
Okay. Actually, is there more? Sorry.
That's okay.
I'm going back. I'm looking now at more of the questions after the interview. Condition management. I just want to mention that my mom helps you with a lot of stuff like driving and doing things, taking you places. Let's see.
She does, and I'm probably not the best person to want to exercise, but I know I have to do it in order to keep going.
Okay, cool. That should be about it. If they have questions, I'll just ask you, I guess. So I'm going to stop the video.